Hi, this is Nan Cochran giving you the December AACH Presidential Message. I recently attended the Institute for Healthcare Improvement Annual Forum in Orlando to provide with a couple of colleagues a day-long workshop on conflict management on teams. And I really want to share with you some of the highlights from the conference as a whole, which really reinforced for me the critical role of our work in improving communication in healthcare. Over the last few years, one of my co-presenters, named Dr. Neil Baker, has asked participants at his and our workshops, what are the greatest challenges they face in doing quality improvement work? So the question he asks is, when you experience problems with improvement initiatives, what % of the time is the predominant issue due to the people and organizational side of change, as opposed to issues applying the science and technology of improvement? And he's consistently heard that between 88 and 92% of the time that the people and the organizational side has been a far greater challenge, underlying the importance of what we do. We were fortunate to hear from the CEO of IHI, named Maureen Bisignato, in her keynote, who spoke to the audience of over 5,500 healthcare professionals there, that it was time to really work to flip healthcare, she said, namely to move from a system that does things to patients to one that works with patients to achieve the best results. And drawing on innovations in education that a number of us are familiar with, including the flipped classroom, she emphasized the need for new approaches and really 180-degree switches in our perspective and our focus. In our shared decision-making work through the AACH, we've been encouraging clinicians to ask the question, what matters most to you in making a healthcare decision? And she underlined and underscored the importance of that question. She also urged us to continue to flip the delivery of care from individual providers to team-based coordinated care, and to stop focusing on volume and focus more on value, and focus on health in addition to health care. There was another keynote given by a patient who shared her story about how important it was to have the options for her treatment for her cancer provided in a transparent way, and to have her values respected when she shared them. And she beautifully demonstrated the importance of hearing directly from patients, which is a change we anticipate, namely to include some patients on the AACH board. We then were fortunate to hear from Dr. Atul Gawande, who spoke about his newest book called Being Mortal. As he said, he didn't learn much about mortality in his training, and his keynote focused on how critical communication skills are in improving end-of-life care in the country. And for the book, he interviewed over 200 people who had either frailty or chronic illness, as well as the healthcare workers who cared for them, everyone from nursing home workers to geriatricians. He found that many of the physicians and nurses were very comfortable with the communication skills that we've been teaching for a long time, and what they do is to really identify people's priorities for their care, which are often very different than simply living longer. Doctors often think they know what patients value, but multiple studies have suggested otherwise, and the most reliable way to find out those priorities is simply to ask. We need to do less of the talking and become better listeners. And he cited some data that less than a third of the people in our country with end-stage cancer have had a discussion of their priorities and goals for their end-of-life care in the last 4 months of their life. And those who were in that third were more likely to stop chemotherapy, were more likely to start on hospice sooner, spent fewer days in the ICU, experienced less suffering, and most surprising, their families, after their death, experienced less depression and PTSD. And in some of those studies, those patients actually lived longer. So the conversation about end-of-life goals helps people figure out their priorities and cope with the anxiety of contemplating their mortality, and in itself is therapeutic. Since this is my last presidential message, I want to thank several people in AACH who don't receive anywhere near enough credit for their work. So to all of our staff, thank you for living and breathing our mission and vision every day. Your passion for what we do really enables us to make a great difference for our patients, families, and caregivers. I'd especially like to thank Laura Singler, our new executive director, who's done a superb job in her first 6 months in the role. I want to sing Dr. Laura Cooley's praises. She's our Director of Education and Outreach and has been tireless in making contacts, expanding our work with different healthcare institutions, and making innovative changes to our newly redesigned website, including providing online education. And last but not least, Lindsay Betterman, our Program Manager, is incredibly hardworking and reliable in organizing and attending to all the critical details and makes our annual courses a great success.